Dr. Danielle Harpen, MD, is Obstetrics and Gynecology resident at the University of South Florida, Morsani College of Medicine in Tampa, Florida. Originally from Kentucky and a first-generation college student, Dr. Harpen began her academic journey on the pre-vet track at the University of Kentucky before discovering her passion for human medicine. After graduation, she spent 2 years conducting neuroscience research in Charleston, South Carolina, strengthening her scientific foundation and solidifying her commitment to a career in medicine. Dr. Harpen earned her medical degree from the University of South Carolina School of Medicine and is now training in a specialty that blends surgical skill, continuity of care, and a deep patient advocacy. She has authored multiple publications and is an active member of ACOG District 12 and aspires to serve as chief resident in her final year. Committed to reproductive health and mentorship, she plans to practice as a OB-GYN, providing comprehensive care across all stages of life. Outside of medicine, Dr. Harpen enjoys competitive horseback riding, reading, and spending time with her husband Phil, their two golden retrievers, three cats, and her horse Spy, embracing the sunshine and outdoor lifestyle that Tampa has to offer. Yeah, is there anything else like that you would like to add to
The
your
only
bio?
thing I'll add is that my pets are probably going to make an appearance, so I'm sorry ahead of time. They're already trying to like jump up on the bench with me.
Yeah, that's
So
completely okay.
I'm
You
sure you
know,
guys will see the cats and the dogs.
absolutely. So to
Thank you
start off,
so much.
yeah, to start off, the first question is just could you kind of explain what OB-GYN is and what you do in a day in the life and just a brief overview of
Yeah,
that.
absolutely. So OB-GYN it's kind of a combination of two specialties, obstetrics or the care of like pregnant people and
Mhm.
gynecology, so the care of all the organs in the pelvis pretty much of a woman. It's pretty unique in that sense that it blends two things. OB and gyn are similar but definitely not the same. So I really see a lot of patients all the way from I saw a 5-year-old patient recently who was having, pre-pubertal symptoms to we see women towards the end of their life needing a hysterectomy for whatever reason. So, and then the whole gamut between that. We're really taking care of patients both in the clinic and surgically. I think that was something that I didn't really know as an undergrad or really even in med school how surgical OB-GYN is. But we're in the operating room daily with patients, whether it's C-sections, small minor procedures, or our big procedures like hysterectomies. So kind of spans the whole gamut of women's health. And with that comes a lot of responsibility too, of course, for like advocating for reproductive rights. So we do a lot of that. That's pretty woven into our specialty as well. Um, a day in the life is a kind of a hard question because I am in my first year of residency. I'm an intern. I graduated med school in May of 2025. And then I matched here at USF in Tampa and started residency July 1st. And so residency, I felt like during undergrad and in med school, I didn't have a great understanding of what it really meant to be a resident. I don't think you can really understand until you're in it, but the days are long, but I absolutely love what I do. Right now I'm averaging about like 70 to 80 hours a week. So, very, very long. Like today, for example, I got to work at 6:15 in the morning and I just got home around 7 p.m. So, and that's a pretty typical day. The days are very busy, kind of depends on what rotation I'm on, but it could be anything from running the labor and delivery floor to today I'm on postpartum, so I'm managing all of the ladies that have already had their babies, to being on gynecology and doing the surgical procedures that come with that. And then we also have some outpatient rotations too. And then weekly I also have my own clinic that I do. So we're always as residents like overseen by an attending. But I'm kind of just residency is to learn what my specialty is and the ins and outs of it. So days are long, but I love it.
Yeah, absolutely. And we with the webinar we had yesterday with the pediatric gastroenterologist, he was explaining how pediatrics is so different than adult medicine. So how do you become so knowledgeable in being able to handle pediatric cases with also adult cases like you were saying or that you
Yeah.
see?
It's kind of interesting you asked that because OB-GYN is kind of in this unique place right now of do we one either extend our residency to 5 years or 6 years. Right now it's about 4 years long because there's so much that we need to cover, or do we split it into two separate residencies, obstetric residency and maybe a gynecologic residency, that's a little more surgical. So there's kind of some talk right now of that because of what you just mentioned, that like we really are covering a huge range of things. We do have, sorry, my puppy is like barking over there. We do have fellowships. And so we have one of the fellowships is pediatric gynecology. So we have our PAGS people that do specialize in like the younger kids. And then we have people that specialize like MFM, maternal fetal medicine, specializes in like high risk OB. So they never see any gynecologic stuff. And then we have a couple other fellowships I could talk about, but we do have people that are experts in like little subsets. So that helps our generalists. If we don't know something, typically we'll refer to a fellowship trained person that, might have a little more training in it.
Yeah, absolutely. That makes a lot of sense. Yeah, there's so much differentiation between pediatrics and adult medicine, like I said. Um,
Yes.
and then how, so you were saying like they would split up um doing OB and then GYN. If they weren't gonna do that, how is it split up currently? Because you said in 4 years, like how is each training of residency differ from the last?
Yeah. My residency, we only do on service rotations, meaning that like I don't ever rotate to an off service thing. Like a pediatric resident, for example, is going to rotate in the adult ICU, rotate through all the different pediatric specialties. Internal medicine is kind of the same way. But simply because we have so much to learn, we don't really rotate outside of OB-GYN. Um, I think my program specifically like does a really good job at making sure we see kind of the whole breadth of things. So like from intern year, we're seeing both obstetric patients and gynecologic patients, kind of more at a basic level. And then each year you kind of get the more complex patients that you're in charge of, and you're in charge of the team. So I think it's we are well trained in all of it, but I could foresee maybe by the time you guys are in residency, maybe OB-GYN residency is either 5 years or it's an OB and a GYN residency, just because there's so much more information. And I think back in the day too, I mean, a lot of you can probably attest to the fact too that like women's health is understudied. And so it was just thought that, oh, you just have a woman's doctor and they handle all of the womanly things. And now, obviously, now that we're in 2026, things are changing and we're learning more and more every single year about women's health. So we'll see where the future of OB-GYN goes.
Yeah, absolutely. Which one would you prefer? Having like the
Mm,
fellowship or breaking it down in two residencies? What do you think would
I
be the
think,
most beneficial?
mm, that's a really good question. I would say probably extending the residency by another year, if need be, mainly if like we need to hit our surgical numbers. I think that could be helpful because like for me, I'm planning to be a generalist OB-GYN. So I really love taking care of like OB patients, and I absolutely love taking care of like, my normal well woman's benign gynecologic patients too. So I think there is something special to say about, somebody that specializes just in women's health. Um, and I think that's kind of the argument of a lot of OB-GYNs is, we want to keep it as one residency. There's a little bit of talk of adding like a gyne surgical residency to like a general surgery pathway. So like maybe in the future, people who are general surgeons or go through a general surgery residency could do a fellowship specifically in gynecologic surgery. So I think that's probably more of what we'll see is maybe just like gen surge people being specialty trained in gyne surge.
Yeah, that actually makes a lot of sense. Yeah, because when learning about residency pathways, there's like so many because I mean, there's a lot that you start with like internal medicine, then you branch out, or you start with general surgery and you branch out. But there's a lot of creativity that can come out
Yeah.
because like you can do a general surgery residency, but then you could go into so many different
Mhm,
fellowships or specialties within that
mhm.
to really find your niche and your specific thing that you really want to do. And
Exactly.
then with you also mentioning like your pets, when
Mhm.
first just reading about you, you originally were on the pre-vet track.
Yeah.
And so I was gonna like I was really interested in how that you pivoted from pre-vet to pre-med. Could you talk a little bit more
Yeah.
about that? And was it like a specific interaction that you had or a class or things like that?
Mhm. Oh, yeah, that's such a good question. I think I got asked that a million times in, like, interviews also. Yeah, my path is a bit unique in the sense that, like you said, I'm a first generation college student, so I never had any exposure as a child to medicine other than when I'd break my arm, I'd go, to the doctor. That's about it. But I grew up in rural Kentucky, and so I had a ton of exposure to animals. And so I think that that was just kind of how I got interested in like medicine and science in general was just seeing, horses be born on the farm. So as I was kind of going through undergrad or high school, I was like, that would be kind of cool to take care of animals. So when I got to be a freshman in college, I got a job as a unlicensed veterinary technician for a small animal vet. And I ended up working there for like 3.5 years and really was like gung ho pre vet until I kind of saw the downsides of veterinary medicine. Um, you're really limited in veterinary medicine by like, people aren't going to pay $10,000 for a surgery on their dog, sadly, if, they break their leg. And so you're really limited a lot by finances, which makes sense. But it was hard to see like a patient or an animal that you wanted to take care of, but you couldn't. So I was starting already to have like some feelings of, maybe I want to keep this as a hobby and not necessarily my career. Um, I did like one final push for pre-vet. I went my junior year of college to Thailand actually on like this pre-vet trip. And I worked at like this elephant sanctuary. And when I was there, it's kind of like a life-changing moment, I guess you could say. I was following around this my elephant for the day and doing like a diet study or something. And the mahout or the person that takes care of the elephant, day in and day out, I got to talk with him and he had, cancer all over his face. He had this huge tumor. And my dad had actually passed away from cancer when I was 4 years old. And so we kind of bonded over that a little bit. And he was talking about that he had a son. And long story short, it really just like opened my eyes of, I care a lot about people. I love people too. So maybe I should look a little bit into using my skills and my knowledge to take care of humans too. So I still wasn't entirely sold, but it kind of started to, change my mind a little bit, that experience. So I did 2 gap years where I was a little bit like, what am I gonna do? And it was during COVID too, so I worked in research in a lab, and while I was there, I shadowed at the hospital to, like, really get more of an idea of what human medicine looked like, and that's kinda where I decided that this is what I wanna do, and I'll keep animals as my hobby.
Yeah, yeah, I whenever I like visualize what being a vet is like, because I have a dog as well back home, and so like I don't know, it's just something about like potentially seeing like my dog on like an operating table. I
So
just can't
sad.
visualize it. Yeah, but like it was just I don't know, it's just a different approach when it comes
Yeah,
to like humans. I don't know how to explain it if
it's
that makes
totally
sense, but
different. Yeah,
yeah, and
it's totally different.
like that your story was very powerful in how like something you didn't even like think would push you in this direction ended up
Mhm.
doing it and going to Thailand. That's probably an amazing experience overall,
Yeah.
and how that just kind of pushed you in this direction. But
Yes.
yeah, could you talk about the your 2 gap years and why you chose
Yeah.
neuroscience research and how that kind of helped you kind of go in this path that you're on right now?
Yeah. So truthfully, I switched to pre-med my senior year of college, but I really didn't. know if it's what I wanted to do, and the pathway was still very similar. So my degree was still in animal science, and I still took all the OChems and the biologies and everything. So I graduated undergrad and was like, well, now what? I don't know. Like, do I want to go to medical school? I don't know. I've not even looked into taking the MCAT. I'm not sure. So I was in this like big transition point of my life. And what I did know though is I loved warm weather and I loved the beach and I had visited Charleston and I loved it. So I just up and me and my boyfriend at the time moved to Charleston, knew nobody, and I wanted to get a job at a hospital, kind of exploring maybe the pre-med path a little bit. Um, Sadly, the only job I could get, but also it worked out really well, was actually at MUSC, in Charleston, and it was in just like a research position. I'd had a bunch of research from undergrad, and I was like, "Yeah, why not?" Wasn't interested in neuroscience in the least bit, if I'm being honest. It just kind of was the job that I had, and I moved to Charleston, and it ended up being like really pivotal in my decision to pursue medicine, because I got to shadow a lot of physicians because I worked there at MUSC and saw them day in and day out. And then it was also a bit good because it was during COVID, so I could kind of hide in the lab by myself and, not have to be around too many people. Um, Gave me a good appreciation for research. It's important. I don't want to do it for the rest of my life because I thought maybe that would be the path I would take too. I was kind of exploring. Maybe I go the PhD route, maybe I go the medicine route. Did the research, didn't love it. um, and I liked the medicine route a little bit more. So I would just say you never really know where life's gonna take you, and I always had the same plan my whole life as being a vet, and now here I am being an OB-GYN, completely different, but, I wouldn't have changed anything. So just be open if your life changes paths and, it might look a little bit different than you originally thought, but that's okay. You'll end up where you need to be.
Yeah, so I'm actually a neuroscience major, but
I'm like, you over
yeah,
here
no, I
crapping
totally
on your
get it.
room.
Like, yeah, I like I'm holy, I can't speak today. I'm involved in neuroscience research as well, and originally I was thinking like I've always wanted to go down the med path, but I was considering MD PhD.
Nice.
But then like when I got to learn more about it, it was a lot more in the lab and taking not
Yes.
necessarily taking care of patients as much, and then that
Mhm.
immediately kind of turned me away from it.
Yeah.
But you have the opportunity to do clinical research as an MD, which
Mhm.
was something that I was intrigued in and something
Yeah.
that I learned in undergrad. So it ended up working out, and so like I still have a potential future in medicine, but
Nice.
still
Yeah.
would have that focus on patients. But yeah,
Definitely. Yeah, you can do plenty of research, as much as you want as just an MD. I thought kind of the same path for a minute too, maybe the MD PhD, but if you really want to be with patients, prioritize the MD over the MD PhD, because the PhD will get you in the lab, and you can still do that, without the PhD, just
yeah,
with your MD. So,
yeah.
not to
So
steer you away from it, but
no, you're all good. Yeah. So moving on to the next question, you explained how OB-GYN has like a little bit of everything.
Mhm.
Could you explain like what US at like University of Southern Florida's program um, really intrigued you and made you
Mhm.
want to go to them for OB-GYN?
Yeah. So I'm sure you guys have kind of all seen the match day videos on TikTok. That was me a year ago. And so a year ago and a month ago, maybe 13 months ago, I was like, oh my God, I don't know if I'm going to have a job when I graduate. What I did know though is I really wanted to do OB-GYN and I wanted to stay in the Southeast. And so I had applied to just programs in the Southeast, mainly just because I love warm weather, like I talked about earlier. And I love the South too. So I applied to a bunch of programs and then I interviewed at programs for residency. And immediately when I interviewed at USF, it was actually before an interview. I did like a little social. I was just immediately in love because the residents were joking around with each other, just hemming and hawing and being goofy. And you could just tell it was a really good culture. So I came down to Tampa to visit because I'd never been down here, and got a tour of the hospital and like immediately fell in love too. Just kind of with the people and with the program. Program wise, I ranked here number one and was really lucky and fortunate to match here. So it was a dream come true. Kind of the other things that really attracted me was, OB-GYN. I talked about how it's a huge breadth and there's a lot you need to learn in 4 years. I had the option to go to smaller community programs, that maybe didn't have as high of a volume or as crazy of work hours, or could go to a program here at USF, that has an insane volume. We're delivering about 7,500 babies a year. That's like 25 babies a day. So I really knew that I would learn all of the rarities, and I would see them here at TGH. And so that was really important to me to like feel confident when I graduated residency, in my skills as an attending because I had seen all of these rare things. And I'll tell you what, the rare things are happening all the time here at TGH. We had a pregnant patient that delivered yesterday that had a heart attack today on the floor. So like we are really seeing like the sickest of the sick here. And I think that attracted me because I wanted to feel, like I said, really confident when I graduated. On top of that, we have so much fun here in Tampa. I don't know if any of you guys have been. It's incredible. The hospital's just like on the water. Our rounding room is just like overlooking the ocean. We are like right there. It's so you can't really beat that. So lots of things attracted me here.
Yeah, so I think definitely as much as people may not or may overlook it, location definitely matters a lot. You definitely want to be in an area that you could potentially like see yourself growing a family or see
Yeah.
yourself staying in.
Yeah.
And I think yeah, that's very important. That's something that I'm really looking into in terms of
Hmm.
what medical school I can get into.
Hmm.
But I mean, that's probably on the back burner because it's already pretty hard to get into medical school in itself.
No,
Um,
it's so important though. You'll be there for 4 years. So
yeah. So could you what about one? Yeah, so as a first gen college student,
yeah.
how did that play a factor in picking your medical school or that medical
Mhm.
school process and then picking a residency program as well?
Yeah, I it played a huge factor for me, and it was kind of a defining thing throughout all of my applications. Like I said, because I didn't really have a mentor, I didn't have anybody in my family that's even gone to college, much less medical school. So I was a little bit blind and probably a little bit naive on this process and had to do a lot of just like Googling and doing things like this, listening to people talk about their paths and how they got in. Medical school wise, like I said, I was in Charleston and I knew I kind of wanted to stay in South Carolina slash in the Southeast. So I applied broadly in the Southeast. I think I got like 3 interviews for medical school. I was like, there's no way I'm gonna get in. Got into one, and it was USC. So all you need is the one acceptance. Didn't have a great MCAT score, but you know what? I did just fine in medical school. So all you guys need is just the one acceptance. Don't read the Reddit pages where you need 500. Of course, it would be great to have, options if need be, but just be enough to impress, just a couple places. So I think truthfully, because I probably didn't have the strongest application, like grades wise, was affecting that. And then residency wise, it was kind of the same thing. Like my mom and my stepdad have no idea what residency even is. They still are like, so what are you doing? Or are you a doctor? I'm like, yes. So I kind of again kind of had to lead into mentors and doing research on myself or for myself. And I felt a lot more informed going into residency. About what the pathway would look like, thanks mainly just to my medical school. But I'd say I was telling you before everybody else logged in, I don't envy you guys applying to medical school. That's a tough and stressful time. So, but you just need the one acceptance. You'll be fine.
Yeah, I mean that's like what I hear all the time from current med students or people who are
Yeah.
in residency is just you need the one because once you get into medical school, that's probably one of the hardest kind of hills that you have to climb, and
Yes.
then from there,
Yeah.
you're there, and then you just have to completely just lock in on medical school, and
Yep.
then you got residency. But I will say, I think yeah, that getting into medical because it feels so like such a huge difference between being an undergraduate student and then a medical student. And
Yeah.
I think that that viewpoint also causes us to kind of go into a rabbit hole, especially Reddit.
Definitely.
Reddit is terrible,
Yeah.
but
Stay off
it can
Reddit,
be beneficial
everybody.
sometimes. whenever you don't see some people just like saying some random things or lying
I
about
know.
the score they
Yeah.
got or all these things. But
They're always lying.
yeah. Yeah, absolutely. But you talked a lot about mentorship.
Mhm.
Could you kind of talk about the mentors that you have gotten along the way and how they've helped you get to where you are right now?
Yeah, absolutely. Um, like I said, kind of undergrad, I felt a little bit like I didn't really have a mentor, other than some of actually the vets that I worked with. They wrote my letters of rec for medical school. And then medical school, it was a bit of a different ball game. Well, undergrad, I went to University of Kentucky, so it's a huge school. And, it was so difficult, I think, to like pinpoint a single mentor. But medical school, once you're in, you're now it's a way smaller class and everybody kind of knows all the medical students. So I was really able to find mentors through one of our people that you cannot hear me. Sorry, my dog's like handing me toys. Through one of our people that just kind of he helped with just like academics and support. He wasn't even a physician, but he really helped just like give me like studying advice the first 2 years so that I did really well on my steps and everything. And then as far as getting into OB-GYN, your 3rd year of medical school is just all clinical. And I think that's really where you can kind of set yourself apart to find a good mentor. When I came into medical school, the last thing I thought I wanted to do was OB-GYN. But during my rotation on like day 2, I really ended up enjoying it. And even from day 2, I started kind of expressing interest to my attendings. Um, Through that, I was able to get a one of the attendings that I started becoming close with her, and she ended up being a mentor for me just by truthfully me just showing interest in OB-GYN and asking her what her life was like. And she was happy to kind of share her pathway with me and the ins and outs and the goods and the bads of OB-GYN. And she was pivotal, I think, in me getting this residency spot because she knew some people here and was able to write a good letter of rec. So I'd say just like be open to mentorship, be open to hearing people's advice. And I think my biggest thing that I notice with medical students is when they're interested, even if you're not interested, just act interested and people will notice, and are always happy to mentor and kind of take you under their wings.
Yeah, yeah, that's like yeah, as I said before, that's kind of the reason we put together this program is to
Yeah.
kind of fill that gap of undergraduate mentorship because a lot of
Hmm.
times like we have upperclassmen who are mentors, but it's not the exact same as
Not the
having
same.
like a physician or the person that or the career you want to go into, one of those professionals being a mentor and kind of helping you
Yeah.
through that process. Because they've been doing it for however many years and they've seen students come and go and like what works, what doesn't work. And so I
Yeah.
think that's really valuable.
Yeah, I couldn't agree more. I think that that's why this is so amazing that you guys are doing this because there is such a huge gap in undergrad. I mean, even looking back, like I said, on my pathway, I had zero mentorship for my undergrad. So you guys are really going to get a leg up kind of being able to do this.
Yep. And you mentioned that your mentor was at the USC School of Medicine. Could you talk about
Mhm.
kind of the like the education and how like the classes were formatted, the grade system, and just kind of how USC School of Medicine is structured?
Yeah, absolutely. I highly recommend USC School of Medicine. I know you're at USC now, but I really loved my experience there. Like I said, it was the only one I got into, but even if I'd gotten into multiple medical schools, I really think USC would have been at the top for me. Things have changed a little bit with medical school curriculum. It sounds like they're kind of always changing, but when I was going through, our first year was really dedicated to the first semester, I should say, was dedicated strictly to like anatomy, and biochemistry. Anatomy is kind of like every medical student has to do it. It's a rite of passage. It's your, day 2 of medicine. You're dissecting a cadaver for the first time and trying to drink from a fire hose is typically what I say medical school is like. So once you survive that first semester of anatomy, then second semester for us was physiology and kind of going into like a lot of mechanisms of actions of how things work in the body. And then second year for us at USC started it was like systems-based blocks. So we'd start with like, say, a cardiology block, and we would learn all of the things about cardiology. So like, again, review the or the physiologies, the anatomies, and then start going into what happens when things go wrong. So what pathologies there are, how you recognize them, the microbiology behind it. It was kind of all lumped into one big block. And then at the end of that block, however many weeks it was, we would take an exam on it called an MBME. And then sometimes we would have like an in-person kind of test too. And then we'd move on to the next block. That's kind of how our second year was structured until we took step one at the end of second year, our first licensing exam. And that kind of combines all of first year and second year. So we had, I think, like a month and a half to study for that. Um, my class was the last that still had grades, which I think I really liked having grades. I think if I could choose one way or another, I would always choose to have grades rather than being pass fail, just because I think it helps to distinguish you a little bit better for residency programs. And then our third year was the typical third year of clinical work, so different rotations. We have a couple core rotations, so let me see if I can remember. Internal medicine, pediatrics, um, we had psychiatry, OB-GYN, surgery, and I'm definitely forgetting something. Sorry, it's been a long day. One more. There were 6 of them. And after each one of them, we would also take like an exam, kind of testing on that. Then at the end of third year, you take step 2, which is still scored. And step 1 for me was just pass fail. Step 2 is still scored. And there's a lot of pressure on that because that score kind of determines what residencies you can apply for. And then fourth year was really just diving into what specialty you're applying for, and a couple here and there things, but mainly just working in whatever specialty you're applying for. So I thought it was structured really well. I loved USC. You should all go there.
So yeah, kind of going off what you said, I had two questions. The first one was, could you talk about your surgery experience? Because that's what I'm interested in as of right now, and then I hear a lot of good and bad things
Yeah,
from different med students and people on TikTok and Reddit and things like
of
that.
course.
And then the second question is, could you kind of break down what your third year is like specifically, like with clinicals, and then also how you balance like step two studying while also you have shelf exams and things like
Yeah.
that.
Yeah, those are such good questions. So, I came into third year thinking maybe I would want to do surgery. Also, I am a super procedural person, so I was like, maybe surgery. So I did OB-GYN rotation before Christmas to kind of prep getting in the OR for the first time before my surgical rotation. Ended up loving OB-GYN, so things changed. But I had a great experience on my surgery rotation. Medical students during third year, you're really expected to know absolutely nothing. And so we'll let our medical students, and I got to on surgery too, like suture skin, suture port sites, maybe get to put in a port. But mainly during the surgeries, you're scrubbed in. You're just learning to scrub and be sterile and in a surgery. Sometimes you'll get pimped on like what the anatomy is, but I really didn't that much. And then you're the wielder of the suction. So you take the suction and wherever the surgeon tells you to put it. Surgeons are not nearly as scary as I think people make them out to be. And I'm a sensitive girl, so they are not that scary, especially if you show interest in it. So I thought my surgery rotation was made up of, I actually worked in the SICU, or the surgical trauma ICU, for a few weeks, worked on urology for a few weeks doing just kind of minor procedures. And then I worked on trauma surgery for a few weeks, and that was really cool. So everybody's is a bit different, kind of depending on where you get placed within surgery. That's what you'll kind of learn is like third year, not everybody has the same experience because they can't have every single person on urology. And there's also just like not enough time to see all the specialties. So really, like, if within surgery there's something you're interested in, whether it's general surge or whatever, try to advocate for third year so that you can be sure to get experience in that. So yeah, I loved my surgery rotation. Obviously, I mean, I'm in the operating room all the time now, so I obviously love operating, but so maybe I'm a bit biased. As far as balancing all of the things during third year, it's hard. I'm not gonna lie. Like third year of medical school was really difficult because you're working a lot and you're still in school a lot. And you also kind of feel like you're always in the way, which you kind of are, but I mean, we love having medical students. Um, so, you typically will show up for, let's just say, like morning rounds. You'll be expected to maybe have even pre-rounded on patients. So it's super early in the morning, depending on what rotation. You go, you do rounds, you learn, you're usually there until afternoon, and then somebody will let you go home. You go home and you still have to study. That was kind of the hardest part of third year. And truthfully, the good part of our residency is not having to study after work anymore. So it's exhausting. And I think for a lot of third years, it's hard at the beginning to learn that adjustment and to learn that life balance. But it's important to learn it because it's what residency will look like. I might not have to study when I get home, but I'm working 13, 14-hour days and I need to be sharp all those 13, 14 hours. So it's important to kind of train your brain to do that. Um, we a lot of times as a third year, you do get sent home, or have like breaks before the exam, whether it's for a couple days. So we give you time to like study. Um, Step two was at the end of third year. And I think I had like a whole, oh, this is Emma coming in here. I think I had like a whole month long break to like really study for it. And I did nothing for that whole month other than just study all day, every day for step. So during third year, you really don't have to worry about step two. You just need to worry about passing the exam for that rotation, if that makes sense. And that will get you ready for step two.
Yeah, I mean, another two questions I have.
Yeah.
But first, yeah, right now I work twice a week at
Hmm.
Lexington Medical Center in
Hmm.
interventional radiology, and my shifts aren't like insanely long, but like just having to go to work and then coming home after already waking up early, like I'm
It's
tired,
hard.
and sometimes I just want to like take a nap and then do my work, but then when I take the nap, it's already like say like 4:30 or depending on when
Yeah.
I go home, and then yeah, then you have to make sure you eat dinner and all these things.
Yeah.
So it's definitely tough. I mean, even now, and like I will say class schedule is probably not even in comparison to anatomy.
But it's good prep. It's good prep.
Yeah, absolutely. Yeah, so like that kind of transitions pretty well into like how do you like deal with all the stress and um medical school and residency, and how do you just like make sure that your mind is in the
Yeah.
proper state?
Oh my gosh. There's no one good answer to this, sadly. I'm still learning and still trying to figure it out myself. I'd say the things that have really helped me through are one, keeping my hobbies as much as I can. So finding something that's really important to you early before medical school is really important. So for me, I obviously love animals. I also am kind of a serial hobby collector. I love reading. I'm learning to tattoo right now. I do CrossFit. So like I do a lot of things. And for example, like today, if I didn't have this, I'd get home at 7 p.m., I'd eat something. I want to just scroll on TikTok, and sometimes I do, but I also try to like force myself to do something that I enjoy every single day as much as I can, but give myself a little bit of grace if I can't. So that's really important. It's just finding like little things that bring you joy, and sticking to them. The second thing I would say is having like an insanely good support system. I know not everybody is lucky enough to have this, but I have like the world's best husband. He's not in medical school. He's not in medicine at all. But like him being my support through medical school and now in residency has made a world of difference. So just having somebody that you can come home and complain to, and they are a good listening ear, and that's invaluable, whether that's your parents, your best friend, your partner. That's also been something that's really important. And then kind of going off my first point, some advice that I got going into residency was do it tired. So like you said, there's really you're never not gonna be tired again. Like, in going this path, you're always tired. I could fall asleep at any point during any day, but you have to just do things tired. So, for example, Monday, I was exhausted, had a really long day, but my friend from medical school was in town, so I went out to dinner with her and some other friends, and, like, it really filled my cup and made this week start off on such a good foot. So even though I could have stayed home and sleep on the couch, just doing it tired and making time for things that fill your cup is what's gonna help you in the long run. But I'm still trying to figure out that balance.
Yeah, I think a difficulty that I have in terms of trying to make sure I do things that I enjoy doing is like while I'm doing them, I'm thinking, oh, I could be like studying or I could
Yeah,
be like preparing for something else. And
yeah.
that's like a problem that I usually run into. It's not
Mhm.
that like I have like I'm try my best to make the time to like go play
Yeah,
pickleball or spend some time with
yeah.
like family or friends. But it's like in the back of my mind, I'm thinking
Feel
like,
guilty.
yeah, exactly. And
Yeah,
I'm still trying to figure out the best way to get around that. Like I don't know if there
yeah.
is a way to get around that other than just accepting the fact of like I just need to chill sometimes. But
Yeah. Yeah. I can totally relate to that. I was the same way. I was always like doing Anki 24/7. And if I wasn't, I felt like I should just be doing Anki. I felt like I never found that good balance until I got to residency and I no longer needed to study when I came home. And now it's better. Now I can do my hobbies. But it's hard when the studying never really ends. There's no end point. My husband would always be like, "When are you done studying?" And I'm like, I don't know, whenever I wanna be. So, that's if you figure out the answer to that, spread the word.
yeah, I'll be sure to. I don't think that's probably one of the more unanswerable questions there are because like when are you done studying? Because like say you study for step one, you take step one, then what's next, you know?
Yeah,
It's
there's
just
always another hurdle. So, you just
yeah.
gotta tell yourself that, and you have just got to force yourself to do things you enjoy.
Hmm.
An hour of doing something you enjoy isn't gonna make or break you failing a test or not, truthfully. I just told myself that.
Yeah, and so I was just wondering, because I hear different takes on this, but
Mhm.
in terms of like the hardest exam you've had to take so far from undergrad to now, which is MCAT step one, step two, what are the biggest differences between them in terms of like studying and like what did you think was the most difficult and why?
Yeah. Ooh, I haven't actually thought about that. All of them are hard. They're all, big, long, standardized tests. I think the MCAT was hard in the sense that there's a lot weighing on it. Like we were talking about earlier, you just need the acceptance, and to get the acceptance, you just got to do well on the MCAT. So the pressure from the MCAT, I think, was the hardest part for me. Um, I'd say overall, though, like most difficult wise, everybody's probably going to have a different answer to this. I'd probably say step 1 was probably my most difficult, which now it's pass fail, thank God. But it was hard just because it was 2 full years of medical school crammed into 1 exam, and so the amount of stuff that you had to know, and the amount of, like, little minor things that I've never even thought about since that I needed to know, that was hard. I always say the smartest I've probably ever been was the day I took step 1. It's just downhill from there. But, all of them suck. They're all hard, but you've gotta do them, and there's a lot of, like, value in doing well on them. Um, everybody that's taking these exams are very smart people. And so it's, I think, hard to be stacked up against that. But, I'm not a great test taker. I'm definitely not a straight A student. Um, but if you want it bad enough, I think anybody could do great on any three of those exams. You just have to have the discipline and like the want and the drive to do it.
Mhm. Absolutely. I think with the MCAT, I think just figuring out like the way you study is probably one of
Yeah,
the hardest things. And
agreed.
the reason I had this question today was because one of my friends, one of my close friends and
Mhm.
like mentors of mine, he just got a step one score back today. So he was telling me about like his whole process of what that was like and how yeah,
Yeah,
you would explain that it's the first 2 years of medical school, which is crammed into one exam. And how there's just so much content
it's a
and
lot.
just figuring out how to take it one step at a time rather than just try to
Mhm,
tackle the whole thing at once. So yeah,
mhm.
yeah.
It's great. It's a lot. And truthfully, kind of bouncing off that, it took me a while to realize this. There's no one way to study, and I think I studied different every single day for every single test. So, I don't want you guys to like think that you need to find the golden answer of how to study and that's how you're going to study for the rest of forever because truthfully, like different rotations have different demands, different content is going to need different things from you. In one rotation, you might need to be a very visual, hands-on learner, and the other, you might need to do a million flashcards just to memorize things. So don't box yourself into saying, "Oh, I only need to do flashcards for everything." And also, like, take people's study advice with a grain of salt because every single person studies in a different way too. So, take little pieces of advice from everybody and just build what works for you for that test.
Yeah, I have a friend who just like can read things like a few times and then he just remembers it. Yeah, I'm not like
Genius.
that. I like the like Anki is great with the
Yeah.
spaced repetition. I think that's probably one of the better ways I learn or
Yeah.
just honestly teaching to other people
Yeah.
helps a lot. And
Yeah.
it honestly made me discover that I really do like teaching, which is like another
Yeah.
aspect that I'd potentially explore in the future. But
There you
yeah,
go.
it's probably one of the most gratifying feelings like when you can see someone actually starting to understand something that they didn't understand for so long.
Yeah. Agreed. Agreed.
And that kind of transitions to what are the biggest responsibilities of potentially like wanting to be chief resident and what that looks like leadership wise, mentorship wise to the other residents? Because it's not just the other
Yeah.
fourth year residents, right? It's the entire residency
It's
program.
the entire residency. Yeah. Our program has kind of different chief residents, but the administrative chiefs, there's 2 of them out of, the 7 of us, and they're, like, our actual chief residents. Kind of my thinking and my want to do it is, there's a lot of responsibility that comes along with it. There's a lot of scheduling and juggling things that come along with it, and I think it's gonna be really great skills going forward into my attending hood. So for us, our admin chiefs are really in charge of the entire schedule for the entire residency. So every single resident's day-to-day schedule. You can imagine too, as people call off and life things happen and clinics get canceled, it's every single day juggling and changing things. And then they're also in charge of our academic schedule. So scheduling lectures and things. We have like a every single week, every Wednesday morning, we have academics. So our admin chiefs help organize that schedule too. So it's a lot. And our residency, like all 4 years, we actually elect who we want our admin chiefs. And so it's pretty much the person that you see as a soon to be graduating third year that's like the most responsible, the most organized, the person you want making your schedules. And so I think that that's like an honor too to be elected by the rest of your class and they say, "Hey, I trust Danielle to do this and take care of it." And truthfully, it looks great on a resume too. So for future jobs. Sorry, my dogs are wrestling now. Um they're insane. So a lot of different reasons. We'll see what happens in the next 3 years if my wants for admin chief change or not. Maybe I'll just be too tired by the end of residency.
Yeah, my next question was going to be about like how that picking process works. Also, I don't know why it
Yeah.
says 5 minutes left in your meeting. I didn't know we would. Okay, I guess we got to stop around 8:30. But the last two questions that I want to ask before we cap off the meeting was
Okay.
one, if you could explain more about ACOG District 12. I don't know if I'm pronouncing that right,
Yeah.
but
Yeah.
that and then also if you could just talk about your competitive horseback riding afterward,
Oh my
that would be
gosh,
great.
yeah. I could talk forever about that. So, ACOG is kind of what we call it's the American College of Obstetrics and Gynecology. They're like our governing body of all things OB-GYN. I really started like following and being kind of a junior member during medical school when I was interested in OB-GYN. And then now as a resident, I'm part of District 12, which is like Florida's and I'm like one of the advocacy members for them. So I actually couldn't go 2 weeks ago because I was on call, but I was supposed to go to Tallahassee with a couple of our residents to help for Advocacy Day. We were going to go to the state capitol and really kind of protest some of these abortion right bills or abortion bills that are on the legislative ballots. And so we do a lot with that. ACOG does a lot too with like public education and misinformation. And I'm definitely really passionate about that too. So just continuing to spread scientific information is something that's important, especially with like pregnant women and the whole Tylenol debacle. I mean, that's a great example of it.
Mhm.
But for me, I really am happy to be part of ACOG because of the advocacy part. We're in the deep South here in Florida, and so just continuing to fight for women's reproductive rights is something that's really important to me, and I get to do that kind of through ACOG. Um, so kind of as the next couple years go on, I want to become more and more involved with it and kind of learn a little bit back to like Econ 101. What goes into even making a bill? How do I use my voice as a physician and eventually like in my own career to help advocate for my patients? So learning a lot of that through ACOG. Horseback riding wise, I I started riding when I was 4 years old. My mom bought a horse after my dad passed away. She knew nothing about it other than she liked horses, and kind of the rest is history for me. I grew up, I like almost did online high school because I was gonna travel and compete. Was never allowed to buy my own horse though, because they're obviously so expensive, and my family, we are not well off. My stepdad's a truck driver, so they were like, "Absolutely not, we're not buying you a horse." So then when I was 17, out of probably a little bit of spite for $500, I adopted an off the track racehorse. He was 3 years old and had broken his leg on the track and had rehabbed from it. And that's my horse Spy that I wrote about. December is 11 years since I've had him, and I've paid for every cent of him since. I rode for the University of Kentucky with him. He went from high school to college to Charleston to medical school, and now he'll be coming down here to Florida for residency. So he's really been with me my whole life. I've done dressage on him, which is if you've seen like the Snoop Dogg dancing at the Olympic videos, it's that. And then we've done a lot of jumping as well. So all kinds of fun things. I randomly tried barrel racing him once. It was terrible, but
Yeah, that's honestly so cool. I mean, I've always wanted to potentially like try riding a horse at least once in my life,
oh
just
my God,
just
you got to
as
do
like a
it.
rite of passage or something like that. But I think yeah, just that you that Spy was went through rehab and then you said
Yeah.
you raced with him at Kentucky?
I didn't race him. I got him like if you think of like the greyhound dogs, how they like
Hmm.
race them and then they like adopt them out afterwards. It was kind
Yeah.
of the same thing. Like he
Okay.
was a racehorse, raced, broke his leg. His old owners rehabbed him and then I adopted him. So,
Well, still, that's honestly such a crazy story. And honestly, I've never heard of people like the horse just traveling with you everywhere. I think that's so
yeah,
cool. And
he's like my dog.
how exactly do you will you get him down to Florida?
Yeah, you pay a shipping company. They get them. You've probably passed like horse trailers on the highway. They just grab them in a horse trailer and they'll bring them down here for a lot of money.
Yeah, I bet. I bet. But yeah, with that being said, we do have a question in the chat. If we can, I think we can answer it quickly. I think the meeting will still keep
Yeah, I
going.
can answer
But
it quick.
yeah, so I can read it out. She
Talk a little bit.
said, "Can you talk a little bit about how the med school application process is similar and different from residency application process? What is some advice you would give to a med student? And then also with
Yeah,
that, what is some advice you would give to undergrad students before we
yeah.
get off?"
They're similar in the sense that they're so stressful and you don't entirely have a say of where you're going. Medical school you can choose MD versus DO, which we don't have enough time to get into that, but there's options there, but overall all medical schools are pretty similar. Residency is a bit different in the sense though that it's a match, so you have to want them and they have to want you, and it goes into this weird algorithm and then they open their envelopes. So that process is pretty stressful, but overall they're similar. You give your resume, you give your grades, you hope for an interview, you interview, and then you find out if you go or not. Advice I would give to undergrads and medical students. I don't know if this is like particularly for application process. Um, Advice is just this is like, I don't know, maybe not the most helpful, but like just go with the flow. You never know where life is going to lead you. And I think like all of my closed doors in life have led me down this path that I'm so happy with that I never thought that I would be doing. I never thought I would be a doctor or an OB-GYN. And so closed doors aren't always a no. It's just kind of a redirection. And I wish I had kind of grasped that a bit earlier. So if you don't get in the first time, it's okay. It's not the end of the world. It sucks, don't get me wrong, but, maybe it's just a good redirection.
Yeah, a big thing is definitely pivoting. I mean, everything, at least my philosophy is everything kind of happens the way it's supposed
Yes,
to.
yes.
Which like the going with the flow kind of gives me a little bit more peace of mind rather than trying to control every single outcome because that's not even possible. And to stress out about that, it's just like you're stressing out about something that you have zero control over.
Yep,
Which
yep.
tends to be the things that we stress out about the most, honestly. But
We're all
uh,
type A.
yeah. But yeah, with that being said, thank you so much for being here tonight. I know with you getting off work around 7 that this is already super late
It's
and this
okay.
webinar kind of interfered with your you time, but I
Oh,
really
it's
do
okay.
appreciate all the questions you answered and all the advice you gave. I learned a lot, and I hope everyone else that has watched today live and then watch later down the line this video have learned a lot as well.